Could you have hepatitis A without even knowing it?
Hepatitis A is a viral infection that damages the liver, caused by the HAV virus. Unlike other types of hepatitis, it does not turn into a chronic condition, meaning a person does not remain sick for life. The disease is acute and usually ends with full recovery within a few weeks or months. However, if not treated on time and preventive measures are not followed, it can also cause serious complications. Hepatitis A is often called the dirty hands disease. This is because the virus mainly exits the body through stool and spreads to others through dirty hands, contaminated food, or water. For example, if a sick person prepares food without washing their hands or touches dishes, the virus can be passed on to others. Drinking unboiled water or eating poorly washed vegetables and fruits can also be sources of infection. Therefore, following hygiene rules is the main way to prevent hepatitis A. The symptoms of the disease at first resemble a simple cold or digestive problem. A person may feel weak, get tired quickly, lose appetite, feel nausea, sometimes vomit, have pain in the right side of the abdomen, and experience fever. Later, the main sign of liver damage appears. The skin and whites of the eyes turn yellow, urine becomes dark, and stool turns pale. When these symptoms appear, the person should immediately see a doctor. Hepatitis A is a contagious disease. One patient can easily infect people around them, especially within households and among children. That is why it is very important to separate the sick person's dishes and utensils from others, not allow them to prepare food, and strictly follow hygiene when in close contact with them. There is no specific antiviral medication for the treatment of the disease. The main treatment method is rest, drinking plenty of fluids, avoiding fatty and heavy foods, and following the doctor's instructions. Usually, the human body fights off the virus on its own. However, in some cases, the illness can be severe, especially in elderly people or those who already have liver problems. If untreated, it can lead to liver failure and even death. Hepatitis A can be prevented. The main measures are washing hands frequently and properly, using clean drinking water, cooking food thoroughly, and washing fruits and vegetables well before eating. In addition, there is an effective vaccine against hepatitis A. In many countries, this vaccine is included in the mandatory childhood immunization schedule and is one of the most reliable ways to prevent the disease. In conclusion, hepatitis A is dangerous but controllable. If a person maintains good hygiene, drinks clean water, and follows preventive measures, they can protect themselves from the virus. If the disease is diagnosed, there is no need to panic. With timely medical consultation and by following the doctor's recommendations, most patients recover completely. Hepatitis A is a viral infection of the liver caused by the hepatitis A virus, HAV. It is one of the most common liver infections worldwide, especially in areas with poor sanitation and unsafe water. According to the World Health Organization, millions of cases are reported each year, though many mild cases go unnoticed. Unlike hepatitis B and C, hepatitis A does not cause chronic liver disease. Once a person recovers, they usually gain lifelong immunity. However, during the acute stage, the illness can be uncomfortable and occasionally dangerous if not properly managed. The virus spreads mainly through the fecal-oral route, when tiny amounts of stool from an infected person enter another person's mouth. Common sources include contaminated food and water, unwashed fruits and vegetables, poor hand hygiene before eating or cooking, and close contact with an infected person. Outbreaks often occur in schools, families, or communities where hygiene is weak. Symptoms usually appear within 2 to 6 weeks after infection and may include fatigue and weakness, nausea, vomiting, stomach pain, fever, loss of appetite, dark urine, pale stools, and yellowing of the skin and eyes, jaundice. Not everyone shows jaundice. Children often have very mild or no symptoms, but can still spread the virus. There is no specific antiviral drug for hepatitis A. The body's immune system clears the virus naturally. Treatment focuses on supporting the body and protecting the liver. Rest is important because fatigue is common. Drinking plenty of water, soups, or oral rehydration solutions prevents dehydration. A healthy diet with fruits, vegetables, whole grains, and lean proteins supports the liver. Alcohol must be avoided completely, and painkillers like paracetamol should be used only with medical advice. Doctors may monitor liver function tests, ALT, AST, bilirubin, to ensure recovery is safe. Severe cases, especially in older patients, may require hospitalization. Some studies show milk thistle, silymarin, may help liver health, but it does not cure the infection. Good sleep and stress management help the immune system fight the virus. Most people recover fully in 4 to 8 weeks, but in rare cases, hepatitis A can cause acute liver failure, especially in older adults or those with pre-existing liver disease. The best way to fight hepatitis A is prevention. Vaccination is safe and effective, providing over 95% protection and long-term immunity. Hand hygiene is crucial. Wash hands with soap after using the toilet and before eating. Drink boiled or bottled water and avoid raw seafood in risky areas. Educating families, schools, and food workers helps prevent outbreaks. Important facts include that hepatitis A never becomes chronic, children often spread the virus silently, the vaccine can still protect if given within 2 weeks of exposure, and outbreaks can occur in restaurants if food handlers are infected. Hepatitis A is a preventable and curable disease. With rest, proper hydration, healthy eating, and medical guidance, most people recover completely. The key is prevention, vaccination, hygiene, and clean food and water. Protecting yourself not only saves you from weeks of illness, but also stops the spread of the virus to your loved ones and community.